Hi, I'm Tony Stevens. I'm working with the group that's presenting ethical decision-making competency. The members are Sarah Chapman, Richard Landaverdi, Kristen Poe, myself, and Dustin Strickland. All healthcare providers, the APN included, face ethical dilemmas. When the APN is engaged in ethical decision making, identification of the problem is always the first step. Once the problem has been identified, the APN then uses thoughtful deliberation to problem solve and determine options and potential outcomes. And at last, the APN must make an educated decision and resolve the problem. So, what's the right thing to do? How do I know the right thing to do? An ethical dilemma is a moral or ethical dilemma that occurs when obligations require or appear to require that a person adopt two or more alternative actions, but the person cannot carry out all the required alternatives. The agent experiences tension because the moral obligation resulting from the dilemma creates differing and opposing demands. In some moral dilemmas, the APN must choose between equally unacceptable alternatives. Examples will be presented in case studies later in this presentation. In addition, we've got some more terms. Moral uncertainty causes unease in the APN, making them question whether their decision is right or not. But a more common terminology that is found often in the literature is moral distress. This results from the belief of knowing the ethically appropriate action, but feeling constrained from carrying out the action because of institutional obstacles, such as lack of time, lack of supervisory support, physician power, institutional policies, and legal constraints. In this slide, we see common themes that might cause ethical issues in nursing. Communication, multiple commitments, and interdisciplinary conflict. To address communication, the APN needs to present information in a precise and succinct manner. In many healthcare situations, there's going to be a multidisciplinary approach, and it's going to be necessary to work with different disciplines such as doctors, social workers, PT, nutritionists, and on and on. The APN will often have competing obligations to multiple stakeholders such as patient and family, colleagues, employers, themselves, their families. So, with these multiple opportunities for conflict to arise, it necessitates that the APN learn ethical decision-making skills.
HAMRIC's core competencies. Advanced practice nursing consists of primary criteria that includes graduate level education, certification, and practice focused on the patient and family. According to HAMRIC, the first core competency of direct clinical practice is central to and informs all of the others. In addition to the central competency of direct clinical practice are 6 other competencies, which include guidance and coaching, consultation, evidence-based practice, leadership, collaboration, and ethical decision-making. Ethical decision-making can be incorporated into all of the core competencies as described by HAMRIC. Ethical decision-making, as well as the other competencies, are essential features of advanced practice nursing. These complex competencies develop over time. No APN will graduate fully prepared to enact all of them. However, it is important that graduate programs offer exposure to these competencies so that the new graduate will have a basis of knowledge to build their practices upon.
Hi, my name is Richard Landaverdi, and today I'm going to be speaking about the traits of the competency of ethical decision making. According to HAMRIC and Delgado, the advanced practice nurse will face ethical decisions during clinical practice and should be able to address these issues. In order to make these decisions, a clear understanding of the competency of ethical decision making must be attained. To attain this understanding, the advanced practice nurse must understand the characteristics or traits of the competency. According to Hamrick and Delgado, the ethical decision-making competency can be divided into 4 phases. These phases make up the traits of the competency and include knowledge development, knowledge application, moral action, creating an ethical environment, and promoting social justice. The process of knowledge development begins in graduate education and is further developed during clinical practice. During this phase, a knowledge base of ethical theories, ethical issues and specialty, professional code, professional standards, legal precedent, and moral standards are learned. This phase is important because it can help the advanced practice nurse prepare for the situations they will see in practice. According to Hamrick and Delgado, Phase 1 will help the nurse distinguish true ethical dilemmas from moral distress. During the knowledge application phase or trait, the APN applies ethical decision-making frameworks to deal with ethical decision-making. Creating an ethical environment. This phase consists of preventative ethics and awareness of environmental barriers to ethical practice. This process is one that is developed as the APN matures in their practice. According to Hamrick and Delgado, the development of an ethical environment is a key predictor of ethical conflicts. Therefore, the more ethical the environment, the less there is a chance of ethical conflicts. According to Hamrick and Delgado, preventative ethics emphasizes that all aspects be reviewed prior to the conflict so that future conflicts can be predicted. The final characteristic is promoting social justice within the healthcare system. This consists of concepts of justice and health policies affecting a population. This trait is the most sophisticated and requires the use of all core competencies of the advanced practice nurse.
Hi, I'm going to go ahead and go over some various case scenarios with you about ethical decision making. The first one that I came up with discusses a new nurse practitioner. Her name's Karen, who's just started her first NP position in a rural family clinic. She sees Susan Rutledge, who's a 29-year-old prima gravida woman who is newly pregnant. Her last menstrual cycle was 5 weeks ago, and she wants to initiate prenatal care. Susan is married but presents alone, stating that her husband is not yet aware of the pregnancy. She desires a child but is not ready to let him know the pregnancy because he has been insisting that they delay parenthood due to financial difficulties. The NP recommends HIV testing as routine screening. Susan declines, stating that she and her husband were both tested shortly before their marriage 6 years ago, and that they have been mutually monogamous for 8 years. Several weeks later, a new patient, Daniel Rutledge, presents to the practice and is scheduled to see Karen as well. The patient states he is concerned about a recurrence of thrush symptoms, a condition he's been treated for over the past several years. He states that he has been HIV positive for 5 years now, and that his wife knows about his HIV status, and that they always have protected sex. He says that he's been receiving care from an infectious disease specialist in the larger town 100 miles away where he works and lives 3 to 4 days a week managing a casino. He states that he called a specialist about the symptom recurrence, and he recommended that John seek immediate attention in his hometown. Karen is stunned but maintains her composure, completes the visit with a prescription for an oral antifungal rinse and a recommendation to follow up with his infectious disease physician. After Daniel leaves office, Karen pulls Susan's chart up and confirms that he is indeed the husband of the patient she saw several weeks ago. There are several different principles and rules that came into effect that a nurse practitioner will have to deal with in that last scenario. Rules of confidentiality. Karen has a duty to keep Daniel and Susan's medical information private. Principle of beneficence. Karen has the right to do no harm to Susan, and not insisting on HIV testing for Susan could mean a delay in treatment and further complications due to HIV for her and the fetus. Principle of autonomy. Susan and John both have the right to make their own decisions. However, one could argue that the fetus also has a right to be protected. My next case scenario is about Brittany Maynard, which is a true kind of case that's going on right now. who's a 29-year-old female patient that has just recently moved to a state, actually Oregon, where there is a Death by Dignity Act after being diagnosed with grade 4 glioblastoma. She went to her APN's office a year ago with frequent headaches, and a CT revealed a grade 2 astrocytoma. She was given a little over a year to live. Last month, she comes back to your clinic stating she can't get in to see her neurologist and her headaches are worsening. You consult with her neurologist, who recommends a follow-up CT. You call Brittany with the results, stating that the cancer has spread and has progressed to a grade 4 glioblastoma multiforme. The neurologist tells her that time is limited and she has less than 6 months left to live. Brittany decides to choose her own ending and will enact her rights for death by dignity. She has chosen to die November 1st, 2014, just 2 days after her husband's birthday. You, as the nurse practitioner, feel strongly against the option and have difficulty with this decision. Several rules that the APN will go through with this last scenario is the rule of fidelity. If this is Brittany's decision, the APN either needs to honor her wishes or to step out of the picture and allow a physician who can help Brittany with her final wishes. Principle of respect for autonomy. The nurse practitioner should inform Brittany of all of her options, including continued chemotherapy treatment, hospice care, and even following out with her Death by Dignity Act that she chose. The last case scenario is about another new family nurse practitioner. Her name's Shelley, who's seen Betty and her 2 young children who are the ages of 1 and 3. The mother is looking for a new primary care provider and would like a checkup for her 2 children. You inquire about prior immunizations while taking a history. The mother states, with all the adverse effects that she has read, she has decided not to immunize her children. Several principles and rules that the nurse practitioner will go through with this last case scenario are principle of respect for autonomy. Betty has the right in the United States to not immunize her children, and Shelley must respect that right. Principle of beneficence. Shelley has the right to inform Betty of the consequences that her children may suffer from not receiving recommended vaccinations. And the last thing is cause history, which was another form of kind of ethical decision making that an APN can use. And it states that in that form, an APN can use other similar cases to go ahead and help make a decision. So Shelley could look up other cases where APNs have had to deal with parents not wanting to immunize their children.
Hello, my name is Dustin Strickland, and I will now discuss the ethical competency research that we found. The first I'd like to discuss is that labs stated that the APN students, that their research showed that there's a varied amount of competency in the ethics content when they tested the students. And this was after they had their ethics classes. And this lack of competency showed that later on it led to some of the APNs experiencing moral distress whenever they dealt with ethical problems in their practice. And then but the students also, after they graduated, this APN stated that they increased their amount of confidence in them to manage these ethical problems after they had these classes. But they weren't prepared, so they needed more practice in dealing with these ethical problems in class. The students stated, after more research, that the ethics education, that it did improve their knowledge of ethics, and it increased their confidence. But the research concluded that it was necessary for educators to educate APNs in ethics. And this will aid in the preparation for the new expanded role of APNs, so to help them better be prepared when dealing with these situations that are ethical dilemmas that they may face in their practice. And just the more experience they retain, the better they are able to deal with these problems. Another journal that was able to find about ethical values that stated that there was provided insight that ethical research is important to the APN clinical practice. So that the students that work with a preceptor during their classes were able to gain more clinical experience and increase their knowledge in ethics and how to deal with the ethical dilemmas that they might face in their practice. And all of the students stated in this research that the transition into the role of APN all of these roles require ethical leadership, and that each part of their practice and each part they would deal with ethical problems in their work, and they needed to be better prepared to do this each day. And this concludes our presentation on our ethical competencies in Hamrick's model for APN.